Chattanooga, as you know, is a runner's town, but with all of that good activity, good for your heart and your overall health, can sometimes come some risks, especially with your knees and your ankles. And so this morning, we're very happy to welcome Dr. Matt Buchanan from the Center for Sports Medicine, talking about not just runners, but other people who've had injury to their ankles and some kind of new techniques you're able to do with ankle replacement surgery. Good to have you.
Nice to be here. Thank you.
So this is pretty cool. I'm going to jump ahead a bit and then we'll fill in the backstory in a minute. But you sat down and you were showing me these little props that you brought in. This is actually something that you're using in the operating room before you get there, really, because it's a 3D image to help you know how to make the materials you need for the replacement surgery.
That's right. So this is this would be the end of the shin bone of one of my patients. So this was created from a CT scan, and from the data on the CT scan, we use a 3D printer to create this model of the end of their shin bone. And from that model, we create what's called a pin guide that perfectly fits like a puzzle on the front of their shin bone. And through this guide, you can see these holes. We place pins through these holes, and this guide, the pin guide comes off and a cutting guide goes on, so all of our bone cuts are made very precisely with this pin guide. So it's great new technology that's relatively new. So
before you get into the operating room, you already know truly what you're going to see and you have what you need to fix the problem.
That's right. So this going in, we know exactly what size ankle replacement, and what this does different than the older technology is it makes our bone cuts incredibly precise, which we think increases the longevity of the ankle replacement.
Okay, now I mentioned at the beginning about Chattanooga being a runner's town. It is the Center for Sports Medicine. However, there are plenty of people who come into your practice who've been injured in ways other than athletic, right?
Yeah, absolutely. So it's, you know, kind of most often the things we see, certainly the athletics, but it's the missing a step, slipping on wet grass, you know, carrying a load of laundry downstairs and not seeing that last step and falling and either twisting or breaking your ankle.
What you said, though, was that ankle replacement surgery is relatively rare. It's not a very common approach to take, but ankle pain is not. People who've sprained their ankles a lot in the past can really have problems develop over time.
That's right. So a lot of ankle pain, you know, the percentage of people that have ankle pain that actually have ankle arthritis is relatively low. So it could be a ligament issue, it could be a tendon issue. But if you're somebody that may be in, you know, sports growing up, you sprained your ankle a lot, some of your ankle pain may be related to arthritis.
Okay, you brought another little guy with you. That's just showing the overall foot, right?
That's right.
And now the bones in the foot, same with your hands, each one, though small, is so important as you go on up your body. Your feet kind of is where everything begins. Is that right?
It's incredible. So 28 bones in the foot. From a biomechanic standpoint, it's incredible. Your feet, during 1 hour of exercise, absorb up to 1 million pounds of pressure.
Whoa.
Which is a ton.
That's a statement to take in.
Yeah.
So, okay, let's suppose that you were to do something and you broke a toe. People will often say, well, what can you do for a broken toe? However, if it's a bad enough break and you don't address it, does that filter up and eventually cause problems higher up in the foot?
It can. Even something as simple as a toe fracture, again, can affect the cartilage in the joint. So some toe fractures don't involve the joint, some involve the joints, and just like ankle fracture might cause ankle arthritis, a toe fracture could cause toe arthritis, which could lead to long-term pain.
I guess as average people, not in the medical profession, but those among us who didn't study this in school, we're learning more and more about the alignment of the body and how important it is. You were also telling me that maybe you injured or have been dealing with a problematic knee on your left side. Over time, the right side of your body will absorb the difference. Is that sort of a way to say it?
Yeah, very true. So we'll see a lot of overuse injuries, and chronic overuse injuries can lead to permanent damage of tendons, ligaments. So if you've got that knee arthritis on the left, it may actually be causing damage to your right foot and ankle.
So if someone's watching and they maybe have been struggling with maybe their ankles twisting a bit and rolling, it isn't very stable, a good idea to come in and see you to figure out what's going on early?
Yeah, absolutely. So what we worry about in an ankle twist is really the damage that occurs to the cartilage. So in this model, you can't see the cartilage, but it's at the top of the foot bone in the end of the shin bone. So bad ankle sprain is actually rolling those bones together, smashing and damaging the cartilage, which can lead to ankle arthritis.
Also, at the Center for Sports Medicine, you have orthopedists who are trained in different specialties within the body. So let's say it's a car accident and somebody's been injured with their hip. But you have doctors who specialize in that hip, but then if they notice the problems continuing to other parts of the body, do you refer within the practice so you've got different eyeballs on the same patient?
Absolutely. So if I see somebody that comes to me with ankle pain and their ankle pain's affecting their hip pain, we've got hip specialists that I can send the patient to evaluate the problem with the hip. Which
is so helpful to the patient because now it's all under one roof as opposed to running all over town.
That's right.
It is a big running season. So the summertime is here, and good luck in navigating your traffic patterns because runners are everywhere. Having the right shoe important because you can just accidentally twist that ankle.
Yeah, it's a great question. So I just wrote an article for the Chattanooga Track Club exactly answering that question is what is the right shoe? And oftentimes the answer to that question is making sure you're not in the wrong shoe. So there's many shoes that could be the right shoe for you, but you want to make sure you're not in the wrong shoe.
Dr. Matt Buchanan, fairly new to Chattanooga, been here about a year, left Virginia to head our way, and we're awfully glad that you did. And thanks for bringing these 3D images. That's very, very cool.
You're welcome.
You'll find him and the other great physicians at the Center for Sports Medicine, the McCauley Avenue location. The phone number we're going to give you there, 624-2696. Sportmed.com is the website. Locations all across the viewing area to make it convenient for you. We're back after this.